Hello everyone, I am Dr. Nisha Bhatnagar, Medical Director at Aveya Fertility and IVF Center. Welcome to our YouTube Academy. So the purpose of these videos is to educate you about the word of infertility and what you can do to treat it. In that context, today I am going to talk about yoga. Yoga plays a very important role in treatment of infertility. I did a project on effect of yoga and counseling on patients undergoing IVF, and trust me, the results were quite remarkable. We see that a lot of females now and even a lot of males now, everybody's talking about stress, everybody's talking about lifestyle disorders. There are many diseases, even young couples we see are suffering from obesity, hypertension and all other problems. So yoga plays a major role in correcting all these lifestyle disorders. Today I am going to talk about few asanas which are going to help you to increase your success if you are going for IVF or infertility. So the first asana in that series is Sukh Asan. Sukh Asan means that you just sit down. If you can keep your one leg on your other thigh and the other leg on your other thigh, that is preferable, but if you can't, just sit on the floor in a crossed leg position, and you have to keep your hands on your knees and just try to breathe in, breathe out, breathe in, breathe out. It helps in calming your mind, it helps in releasing the stress, and it helps in putting the things in perspective. So if you are doing it 5 minutes a day, that is more than sufficient. The second asana which I suggest to my female patients is cat-cow pose. I think all of must be exposed to you. You have to be on your forelimbs, and then you have to, when you arching your back, at that point of time you have to raise your neck and you have to raise your tailbone. Then at that point of time you have to inhale, and then as you exhale you have to do the backward motion, putting your chin near your chest, and the back of the back needs to be arched back. Simple cat-cow pose. If you can search out in Google, you will see a detailed presentation, and that will be really helpful. The third asana is butterfly pose or the Baddha Konasana. In butterfly pose, again the heel should touch your genital area, and you have to gently flip your knees up and down like a wings of a butterfly. This also helps in opening your pelvis, increasing the blood flow and increasing the chances of success of implantation. So the fourth asana which I suggest is lie down on the floor or the mat and then raise your legs at a 90-degree angle. After that, you can do three things. One thing is you do cycling with your legs like this way. Second is you flip your legs, one forward, one backward, one forward, one backward, and then you do crisscross with your legs. Lying down on the floor, the hands on the floor, and the legs do this. So all these three movements help in releasing the deposit of fats in your abdominal cavity, tone your abdominal muscles, and increase the blood flow to the genitals, which helps in implantation. The fourth is the supported bridge pose. Supported bridge pose, you again lie down, but then with the feet on the floor, you try to raise your lower pelvis. So it is in a sort of a bridge pose. Okay, keep it there for 5 to 10 seconds, then slightly bring it down. Again keep it for 5 to 10 seconds and then bring it down. So the last asana which I recommend is the child pose. A child pose is simply you sitting on the mat, bring your hands forward, bring it to touch the mat, slowly bring your chest forward and touch with your head the mat. This basically helps to calm down your nervous system and brings a lot of hormonal balance in your body. Usually 5 minutes of this is more than efficient. If you have any questions regarding any of these or you want to know more information about this, please feel free to contact us at the given number. Thank you so much.